Okay, so good morning. I want to thank you for joining us this morning for this presentation on poultry health management. My name is Dr. Ede Tumor. I work with Biosol Veterinarians, Abuja. Um, and so today, like I said, we're going to be discussing on the prevention and control of poultry diseases. I will quickly go over to share the screen with you. Okay. Right. So what we are sharing this morning, quickly, I take you through what we're going to be talking about this morning. Okay, so I've already introduced myself. I quickly say the purpose of this seminar is twofold. Number one is to educate, to inform you about poultry health management and how you can take some of the principles that I'm sharing this morning and implement them in your own poultry production. So what are we covering today? We're covering the following areas. We're talking about the impact that poultry diseases have on the poultry industry. We also try to define what poultry health management really is. We're going to dig deeper and look at the principles of poultry disease control and prevention, and then I will discuss the standard operating manual for poultry disease prevention and control. So what is poultry health management? According to Professor Simon M. Shine in ASA Handbook of Poultry Disease, poultry health management is a continuous activity by management which involves a continuous evaluation of risk, implementation of biosecurity and vaccination, and analysis and review of production and financial performance. As you can see from the diagram there, it's a cyclical process. After each production cycle, you've got to evaluate the risk of disease and examine your biosecurity measures and all the other data from your production. And so quickly look at the impact of poultry disease on the poultry industry. Number one, poultry disease causes high mortalities and depressed productivity in the poultry industry. As a matter of fact, poultry disease has been reported to account for over 30% of losses in the industry. The losses are one directly, which is caused by disease outbreaks and loss of production capacity. And the other losses come from the poor product quality, loss of revenue because of that, and of course, recall of contaminated poultry products as a result of infections, right? Number two, some poultry diseases do have public health significance and lead to closure of poultry farms or recall of poultry products in order to protect consumers, like I've said already before. Now, poultry diseases can make farmers go into debt, bankrupt because of failure of the enterprises. You are aware that many farmers actually borrow from friends and banks to invest in the poultry enterprises. Poultry disease could threaten food security because it leads to the loss of animal source of animal protein, which is important for human nutrition. Okay, and finally, poultry disease exacerbates the two evils of unemployment and poverty because people get to lose their jobs as farms are meant to close down, right? Okay. And so the principles of poultry disease prevention and control under three subheadings: prevention of disease, early detection of disease, and early and complete treatment. We're going to dig much deeper into all these areas as we proceed in this presentation. But meanwhile, let us look at what manual of your poultry disease prevention control should look like. The SOP here refers to Standard Operating Procedure Manual of Poultry Disease Prevention. So every farm should have a standard operating procedure of manual for poultry disease prevention and control. Your manual should contain subheads like poultry health management team, how disease could enter your own farm. You need to look at your own environment. We're going to be looking at how disease enters farms, and then you will see the ones that would apply to your own particular environment. Then we're going to look at further to you need to have a plan for prevention of disease, and you need to have a plan for early detection of disease and early and complete treatment and emergency preparedness. Okay, so your poultry health management team should consist of your poultry attendant, and because these are the people that will be implementing all the preventive and control measures on the farm. So they should be a member of your team. Or other farm workers who may not work directly with the poultry, they should also be assigned roles, and they should understand how their work affects the health and can contribute to preventing and controlling disease. The farm manager, the veterinary doctor, the owner of the farm, of course, who is going to give leadership to the entire team. The hatchery managers and suppliers, of day old chicks. You have to be in touch with them and let them know what is happening with their day old chicks, because there is some diseases that could be transmitted right from the hatcheries, and so if you have issues in your farm that you suspect could have come from the hatchery or from the supplier, you need to notify them so that they make the necessary changes. Your feed manufacturer and supplier should be a member of your team, and you should let them know how your birds are performing with their feed, and if you have issues that you suspect are due to the feed that they supplied you, you need to also get them informed about that. The veterinary authorities, there are some diseases that are reportable, diseases like Newcastle avian influenza disease. You need to have at least one person in the veterinary authorities to be aware of what you are doing, what's going on in your farm. As a matter of fact, all poultry farms are supposed to be registered in Nigeria. You keep more than 200 chicken, the law requires that should be registered, with the government. But unfortunately, I don't know where this is done at the moment. Okay, so your banker should know about, should be a member of it, of your poultry health management team. So if there's any outbreak and you borrowed money from the bank, you need to discuss with them on how you can renegotiate your debt and to stay in business. And your insurer, where your farm is insured, you also need to know about, should be a member of your team. Okay. So how disease enters a poultry farm, there are several routes through which disease could enter your poultry farm. And so you quickly just look at the ones that are very, very key to and strategic to your own operations. But I want to state that the number one source of disease transmission are people. So you have to put in place measures that would ensure people do not bring in disease to your farm. And the people includes your workers, your visitors, customers, veterinarians, and all the other poultry farmers that you interact with. So we just move a step further to consider the preventive measures you have to put in place. The first on the list is the biosecurity. There are three levels of biosecurity. We have conceptual, structural, and operational biosecurity. So what is biosecurity? Now, biosecurity are measures that are implemented to prevent the entry and further transmission of pathogenic organs on a facility or farm. Okay, for instance, at this time that we're having COVID-19, social distancing, hand washing, and the use of sanitizers and face masks are all biosecurity measures that are meant to break the transmission of the virus. Okay, so these principles are also applied in the in preventing poultry diseases. All right, so biosecurity, conceptual biosecurity is actually the first level of biosecurity. And here you will give attention to the location of your farm in relation to other farms, buildings, and major roads. Because disease can be transmitted from one farm to the other, okay, and of course, road could also impact on how fast disease transmission gets to your farm. Right, so want to note that changes cannot be made to conceptual biosecurity in the event of a disease outbreak because you've already built the house, the poultry house there. So if you have any disease outbreak, the only option available is to see how we can improve on structural biosecurity, which is the second level of biosecurity. And this has to do with the farm layout, how you lay out your farm, how people come in and go out, which how do they meet first, and the relationship between the poultry houses and offices and the litter pits. So you take that into consideration. It also includes procurement of the contamination equipment, perimeter fencing, change room for staff, pest control, and waste management, rodent and wild birds control, interior furnishing of pens. Now you can make changes, to structural biosecurity in event of an outbreak. And so if anything happens, you just have to look at what you've been doing before the outbreak, what could have opened up the farm and allowed the disease to enter. Okay, operational biosecurity, and these are a set of daily procedures and policies implemented by everyone to prevent disease. Operational biosecurity can be improved in a short notice if there is an emergency. So how do you implement a biosecurity program? One, you evaluate your farm operations. You need understanding of epidemiology. Epidemiology is knowledge of disease causing agents and their behavior. How long do they last, on the farm? Their disease can stay on your farm for even after you have decontaminated, the premise, they can be there, for years. And so you need to have the knowledge. If the disease is diagnosed, you need to have the knowledge. For instance, coccidiosis is a present risk, in deep litter production. So you must have a plan. So you need an understanding of the epidemiology, how the disease agent behaves, and all that, and what you can use to deal with them. It's a teamwork. Everyone must be involved. Like we said, it's already set up your own poultry health management team, and so everyone should be involved. If you need to make any changes to it, everybody should be involved. It's a structural thing. You must plan and evaluate the programs regularly. You must be able to allocate resources and train the personnel on all the measures, the roles they have to play in making sure that your biosecurity program is effective. You also need to implement procedures, including erection of facilities. If you see that your farm is just open, and anybody can walk into it at any time, we need to provide restrictions and so that and restrict people from coming in contact with the birds. It requires continuous monitoring and analysis of the procedures that you've put in place. So your biosecurity program should include control of movement in and out of the farm. This includes people and vehicles. The contamination of housing and equipment. This involves washing and disinfection. Unfortunately, a lot of people do not do this very well. Control of rodents, control of wild birds. The contamination, you wash first and then you disinfect, because some disinfectants require direct contact with the organisms to be effective. And if you do not disinfect, you don't wash to remove the organic matter that's covering the organism, the disinfectant may never work. Okay, so the second preventive measure you can put in your farm is use of vaccines. Vaccines is used worldwide to prevent and control poultry disease. So vaccine is a molecular agent or part of it that can activate the immune system of an individual when it is administered. So you follow the following guidelines in the use of your vaccines against diseases that are vaccinate against diseases that are prevalent in your locality. So vaccination program is local. Uh, you have to make sure that the vaccines are available in the quality and the quantity that they're required. You also have to consider the cost of vaccination in relation to cost of risk and disease outbreak. Um, you have to assess the risk of exposure, okay? You must look at your management system and everything that goes on in your farm. Like we said, you have to evaluate your operations, in public and poultry health management to identify the risk. Show you the chart on how disease enters your farm. So you look at the risk of disease entering your farm through any of those channels and then take the appropriate measure. Consider the cost of administration and vaccine. Follow recommended routes of administration. Vaccines could be administered through water, drinking water, by aerosol, by spraying, subcutaneous and intramuscular, percutaneous, like the wing scab that for fowlpox vaccination is percutaneous, intramuscular. We're looking at vaccinations like Kamarov, intranasal, intraocular, and all of that. So you also have to consider the timing of the vaccination to avoid interference by maternal antibodies. And you also need to avoid timing periods of stress. And then, of course, periods of in which you have to maybe change the feed from broiler starter to broiler finisher. So you've got to avoid those periods of stress. And you have to make sure that your feed are of the highest quality possible, because the birds would need the nutrients in the feed to build their immunity. Okay, so just mention this, that there are different types of vaccines. You have the live vaccines, you have inactivated, recombinant, and nucleic vaccines. So these are the different types of vaccines that are available. But at the moment, in the poultry industry, live inactivated and recombinant vaccines are mostly used. Okay, the objectives for vaccinations are to increase the immunity of vaccinated flock against prevalent poultry diseases, to reduce the impact of poultry disease outbreak in the flock. I mean, to reduce the impact, and it's the vaccine works in at least three dimensions in preventing disease. Number one is that it can actually stop the birds from getting infected. Number two, it can stop the birds from transmitting the disease from between themselves if the disease is already in the flock. And number three, it can prevent a carrier state. It's a state whereby the birds are not sick, but then they are disseminating the 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 organism, and that could persist on the farm. And number three is that you want to boost your productivity and profit, okay? Because healthy birds lay more eggs and put on more weight, and that means more money for you. Okay. So what are required for requirement for poultry, effective poultry vaccination program? Use vaccines that are certified and proven to be effective, ease of access and availability, quantity and quality, consistent potency of the vaccines under normal storage application. Um, Make sure the equipment and method of application are in good condition. Use trained personnel. Flock should not suffer from immunosuppressive poultry diseases such as gumbaru, avian infectious anemia. Avoid adverse interaction with other vaccines and management activities in terms of timing, dose, and application. Monitor response to vaccination programs, implement biosecurity to reduce risk of the immunity being overwhelmed by excessive load of pathogens. Now you can also use medicine and drugs to control or pre- tre- pre- prevent and control poultry disease. Um, Drugs are used in two areas, either as preventive or curative measure. Follow the guidelines, okay, by the manufacturers. Now, the disadvantage of drug use that drugs are very expensive. There is the risk of development of drug-resistant germs in poultry, livestock, and even in humans. Number three, continuous use of drug is actually a sign of poor biosecurity and vaccination programs, and of course, poor management. Okay, the last but not the least is nutrition. You, by feeding your birds well, then you can also prevent disease. Now, nutrition is key because it promotes good health, boosts immunity, promotes growth, and enhances poultry performance. So we look at flock management. Flock management basically here is about the living environment of the birds. You have three levels of flock management: chick management, broiler production management, and layer production management. So you have to look at their living environment in terms of the lighting, temperature, the floor spacing, the quality of the floor, the wall, the ventilation, and air quality, the quality of the litter if you're using deep litter management, and of course availability and access to feed and water. So you have to look at those things. Make sure that they are in good condition. Okay, you need to monitor disease occurring in your farm. So this is important. Uh, this monitoring includes daily monitoring. You have to monitor their feeding habits, their physical well-being, their posture. We look at their quality, the color, and the nature of their droppings, how they breathe, the social behavior, and the pests, wild birds and rodents in the poultry and all that. So if you have, for instance, a rodent attack in your poultry farm, you can be rest assured that if you don't do the necessary things, you'll be exposing your birds to salmonellosis. So you have to also monitor their weight and egg production, and of course record daily mortalities and morbidities. So this chart is just to help you recognize healthy and sick chicken. The health characteristics are there, the posture, um, we have the healthy signs, because healthy chicken behave differently and sick chicken also behave differently. I'm going to be sending you the, the slides of this presentation after now. So at your own time, you can go over those healthy signs and on healthy signs to be able to know when action is required. Okay. All right, so we have some pictures here. It shows you sick and healthy chicken. You have this one with swollen eyes, and you see these other ones, the eyes are just so bright. Okay. And then you have this with the twisted neck, and this the neck is so straight. And so you see these ones too, wearing a coat. We call this coat posture, coat wearing posture. And then on the right, you can see the very active and well-fed, local chicken over there. Here and there, so you can even see the tendons, they're so prominent. So this is what you look at. It's okay. So the other early detection of poultry is method is post-mortem examination. Post-mortem exam should always be performed by a certified vet doctor. Okay, so it's very, very important because vet doctors are trained to identify diseases, so they know, they have the skills, they have the know-how on how to know what's going on. All right, the postmortem tells you this why it's important that we do postmortem. One is that disease attacks specific internal organs, and this helps with proper diagnosis. Postmortem also helps with differential diagnosis because many diseases can show same physical signs. Okay, for instance, You say your bed is having whitish diarrhea. This could be gumboro, could be Newcastle, could be salmonellosis, and so. But when you go inside, you see that the changes in the organs are different, and some of the changes are just peculiar to the diseases. So that helps. Okay, it's also an opportunity to collect tissues and collect samples for laboratory tests. The guidelines for, okay, my 30 minutes is up. The guidelines for submission of samples for postmortem are that they should include dead and live birds. The live birds should include sick and healthy birds. Dead birds should be fresh, not more than 24 hours after death, and all that. So you have the guidelines there. Okay, the next test is diagnostic test. You do blood tests. You can do bacteriology, total serum protein, and there are several tests that are available for poultry diagnostics. The third principle is principles of drug medication. You start treatment early, follow your doctors and drug manufacturer instructions, and keep to the withdrawal time, avoid drug under overuse. And your emergency preparedness strategy, you should plan for emergency and appoint a leader. The plan should include measures to prevent spread of disease to the farm and community. Measures should reduce load of disease-causing agents. You should have emergency numbers, including relevant government agencies, bank, and insurance. And you should also plan for a recovery and restocking plan. And you should include a post-emergency assessment to measure impact, readiness to open, and risk of disease outbreak. Okay. Okay, so that's, you have it there. So thank you so much. If you have any comments, please you can contact me by phone. The phone number is 070-3510-3834, or you can do me an email at editum@live.com. Thank you.